It's disgraceful, but it's a playbook, and it's been happening for decades. It happened in Love Canal. It happened in Times Beach. You came into contact with Flint. This isn't what we're taught our country does, but it is, in fact, what they do historically.
Hey, it's Jordan with Status Coup.
This is Ashley with Status Coup.
On the ground.
In Philadelphia.
Flint, Michigan. East Palestine, Ohio. Please support the leading independent news outlet on the ground.
Covering what the corporate media covers up.
FEMA and the White House covered up the East Palestine devastation. Colin, if you have that article. Burned 5 tankers containing 115,000 gallons of toxic vinyl chloride over East Palestine. Residents were sick and crying out for help. In September 2023, 7 months later, President Biden issued an executive order sending FEMA executive Jim McPherson to East Palestine to assess the community's unmet needs. But new documents from FEMA obtained through the Freedom of Information Act show extensive coordination between FEMA, the White House, the National Security Council, the EPA, and the Department of Justice, voicing serious concerns about health, toxins, and the unmet need of East Palestine following the train derailment. I'm adding this isn't from the article. They were voicing privately serious concerns while publicly telling folks everything's fine. But publicly, the message was that there was nothing to those concerns. Quote, it showed that FEMA knew healthcare was the #1 issue, Leslie Pacey told News Nation. Pacey, who we've had on before, is an investigator with the Government Accountability Project who sued to get these documents when FEMA refused to turn them over. I wonder why FEMA wouldn't hand them over. Quote, they also knew that they called this plume a really toxic plume. They knew that there would be the potential for cancer clusters, Pacey said. The agency noted in the private emails, quote, the occurrence of a cancer cluster in East Palestine is not zero, and expressed the need for, quote, a tripwire to identify cancer clusters. Pacey added, it was only discussed internally, and it actually was discussed all the way up to the White House. Quote, there's White House officials and National Security Council officials discussing the dangers of the cancer cluster potential and the health issues and discussing whether or not to release the unmet needs report to the public and to the media. They never released the, quote, unmet needs report to the public or the media, and the FEMA coordinator sent here by Biden wouldn't meet with the residents. Quote, a lot of us emailed and called that person and never got through. Eventually, there was something said that didn't need our anecdote, that he didn't need our anecdotal reports, reported Krista Graves, resident Krista Graves, who we're about to interview, told News Nation. Yeah, we don't need the reports from the fucking poison people. Pacey said McPherson was, quote, nicknamed by residents as the Ghost of October because they were expecting him to be there in October but never could get a hold of him. The email reveals that the FEMA coordinator was told not to engage with residents. Hey, if you're watching from Flint, sound familiar? Residents in East Palestine say it's criminal negligence. Quote, we're supposed to believe that that's not how our country runs, Graves said, and I'm starting to see that's how our country is always run. Joining us now is Krista Graves, one of the many residents from East Palestine that has been drastically and negatively affected. In addition, her lawyer, Christina Bayer, who's representing, I believe, over 700 now residents in East Palestine. There's another story we want to get to. This is about the CDC. So it's not just the EPA, it's the CDC. But before we get to that, Krista, let me start with you. How are you doing? I know that's a dumb question because I know the answer, but tell the audience how you others are doing because I still speak with residents and there is definitely something to see here.
I would say we're doing the best we can. We're thankful that we found a law team that we feel confident with, for once, finally. But people are still sick. People are still homeless. People are still in secondary housing situations. There are people still paying 2 mortgages, sick with things that they should not have had, cancers and organ failures and endocrine problems and thyroid issues. You know, you hear a lot about nosebleeds and headaches and rashes, cognitive problems, memory problems. The list goes on endlessly, as you know. We had a list of 95 symptoms that just the way they were reported to us as residents. Ashley had made that list. Things aren't great here. And I've even seen people saying, well, yeah, I've had changes in my health, but my doctor says it's just my age. And they've done that to my mom, too. When I encouraged her to go to that clinic in town, they giggled and covered their mouth and said, that's your age. Well, her age was the same before she returned to East Palestine and didn't have these problems. They broke HIPAA by telling me outside of her permission that they didn't think her memory problems were related to the derailment when she didn't have problems like that prior to coming back. This is not I'm not the only one. As you know, you've talked to many of us. There are lots and there's so many that they'll talk to us privately, but they're not going to come forward.
And
they don't want to face the harassment.
And it's very similar to my experience covering Flint. Tell me if this has been the issue. This has been common. But when I talk to people who live in East Palestine or Western Pennsylvania, if they're lucky enough to get away for a couple days, a week, some people have moved to trailers out of town, their symptoms clear up. But when they're forced to come back, pretty quickly, their symptoms come back. Has that been your experience?
Yeah. I mean, it's pretty common. Some people might need to be away longer for it to clear up. Other people might have a pretty immediate relief. And it's just tragic. History sets the precedence on what to do with this, with Love Canal and Times Beach. And there was an interview, I believe it was on February 7th, where Trent said there is talk of a 1 to 2 mile buyout. And now you cannot find that footage anywhere. He said in a city council meeting recently that he did fight for a buyout. But if you go back and look at Love Canal and Times Beach, the leaders fought with the residents. And I'm hoping maybe since Norfolk seems to have taken their thumb off of him or, set him free, I just feel like they really tried to control him a lot. I don't know the man, but I feel like
you're talking about the mayor of East Palestine.
Yeah. And I wouldn't want his position in this. I can't imagine. I cannot imagine.
Before we move on to the CDC part of this, because that's a secondary scandal, I want to ask you, the fact that they're saying basically, yeah, this could be a cancer cluster. The fact that they're saying privately, hey, just let's keep it here. Let's not talk to the residents. What does that say to you? Because you've literally, and we exposed him, you had an EPA official on the ground for 2 years, basically, in my opinion, giving you lip service that everything's fine. Our testing is showing nothing abnormal. We can't draw a straight line between the derailment and all your symptoms. Essentially, it seems to me they were telling you publicly nothing to see here, but privately they're clearly saying maybe we should be doing more here.
There was a lot of that. There was FOIA, I think, released on the first anniversary where somebody from Superfund was asking somebody else, shouldn't we be getting involved here? And no, that was the answer. No, this isn't it. Something about declaring a public health emergency. Oh, no, that's only ever been done once in Libby, Montana. There's so many instances where they've covered up. And there's times that the EPA coordinator here would tell us one thing to our face, and then we'd see him on TV in a few minutes or a day later saying exactly the opposite. And you've heard some of the recordings of what he's said to people in person.
Right.
It's disgraceful, but it's a playbook, and it's been happening for decades. It happened in Love Canal. It happened in Times Beach. You came into contact with Flint, and it's continued on to Conyers, Georgia, and Moss Landing, and I'm sure other places that had disasters in the meanwhile. This isn't what we're taught our country does, but it is in fact what they do historically.
Right. And I want to move on to the CDC part, but we do have a lot of new subscribers in recent months. So some of you, I want to really put a face to this because I want you to understand people are sick. I was there. I think this clip was from 6 months ago, perhaps, maybe a little longer. But within the last 6 months to a year. And residents just kind of rolled up and I got 7 or 8 people together just to interview them. what you're about to hear is not 5 years ago. It's like 6 months ago. And these are residents, different ages, that are in ground zero while the media has moved on for the most part, while politicians, we'll get to Trump and Mr. Vance in a minute, have moved on. That's why we say this is called a corporate sacrifice zone, because they have been sacrificed. Colin, if you have the clip where I'm on the front porch with a bunch of folks.
But still, we have to make it work with the mistakes that they did, and no one's willing to test in my home. I have to do it myself. My house has formaldehyde above the allowed limits to live in, vinyl chloride inside and outside, and we're still waiting on anything to happen. People are still getting sick. We have kids that are going through puberty issues with hormones. They're getting acne at age 6.
And the puberty issues are coming years before puberty would normally start.
I'm not a doctor. Keep that straight. I'm not a doctor. I've talked to people. I do know from having a family member that did go through early puberty. Now, it is very uncommon for a whole town and surrounding areas to have kids around the age 6, 7, and 8 to have hormones to produce puberty.
I suffered through severe heart failure. My wife has high blood pressure. My one stepdaughter gets nosebleeds. And my 8-year-old, she's 9 now, but my 8-year-old daughter is one of the ones that Ashley was just talking about with going through puberty at 8 years old.
Were you and your wife and your kids having these issues before the derailment detonation?
Absolutely not. We were perfectly fine. Since this has happened, I've been unable to work. Like I said, my wife, she had like stroke level high blood pressure. My heart, it grew to double the size, and my ejection fraction went down to 16%.
To get too personal, but you mentioned your 8-year-old daughter is now developing puberty in terms of her a cycle, or?
She's had multiple. We actually just went to a doctor about a month ago or so. She actually had got an injection. She has to get every 3 months for a while just to pause it.
So that's in East Palestine. I've interviewed multiple times. If we have time, we'll play it later. A man in his 60s who has double breast cancer in Western Pennsylvania, just a few miles. Breast cancer is very rare in men, much less double breast cancer. Unfortunately, he's not doing well. Talked to women. I've interviewed women who are all of a sudden got dementia at a relatively low age, younger age. I mean, we could go down the list, and they're being told everything's fine. Norfolk Southern, some might look at a settlement number of $600 million and say that's a lot of money. Well, it's not a lot of money when you're talking about a place that unfortunately might become one of the worst cancer clusters very quickly. Before I bring you in, Christina, I just want to move on to the CDC part of this, because this also recently came out. The CDC told health providers not to treat residents after East Palestine. We actually broke part of this story 2 years ago. But this is part of the lawsuit going on right now that you're involved with. 2 years after the Norfolk Southern train derailment in East Palestine and the subsequent toxic plume of smoke that devastated the area, a lawsuit against Norfolk Southern alleges a conspiracy to deny health care to those impacted. Tara Hicks, Krista Graves, Krista's with us right now, and Lonnie Miller are among the 793 East Palestine residents involved in the litigation against Norfolk Southern, and more than 50 other defendants, including state and local agencies involved in the investigation and cleanup. The lawsuit alleges a conspiracy to deny health care on behalf of Vanguard, BlackRock, Mercy Health, and Quest. Vanguard and BlackRock are significant owners. I believe one of the largest owners of Norfolk Southern. Quote, "We've been lied to from the beginning," said Hicks. "They've said everything is fine, and when we know that's not the case, and now we're finding out for a fact that we're right, we've been poisoned." The lawsuit cites the CDC for, quote, "failure to ensure proper public health response, testing, and medical support for the affected residents of East Palestine." It also alleges the CDC, quote, "negligently instructed health professionals and testing facilities not to test for dioxins and other toxic chemicals, denying residents accurate diagnosis." This is your lawsuit that is going on right now. So tell me, I guess I'll I'll start with you, Krista. You're one of those being represented. This is another thing you guys were screaming at for pretty quickly, right out of the gate, that we're not even able to get tested for certain things because doctors were telling you they're being told not to test.
Yeah, we knew that early. There were doctors who had said, there were doctors' wives who had overheard the Zoom, and then Dr. Chai was very, very upfront and out in the public about it. And somehow it seemed many still didn't really believe that it was true. I'm surprised at this point in the game and heartbroken for them because the betrayal is significant. You know, you're trusting these people with your families, and they're the only people that we have. I mean, who do you go to besides the doctor? And who do they go to besides the governing bodies? This was an atrocity of justice and an atrocity towards human beings. That's the biggest thing, is none of our families asked for this. Not one asked for the risk that will be faced for the rest of our life. You know, Wayne O'Connell, as you know, is not doing real well. His family is struggling, and he deserves better than that. His family deserves better than that. Pennsylvania dropped the ball as badly, if not worse, than Ohio. They didn't even allow their 1 mile residents to evacuate until Sunday night. A lot of people don't realize how close to the border it is. I had heard different independent experts throwing out different mileage zones for the Benton Burn evacuation, but it was not 1 mile. I heard 50 to 75 miles. They really all just sacrificed everybody here. And the amount of manipulation of the data and of the presentation of what happened really has most of the people who aren't feeling symptoms right now feeling like we must be crazy. We must be the ones that have a mental problem. We're just conspiracy theorists, when this is exactly what we've been saying from the beginning.
And Christina, you're one of the lead counsels representing almost 800 residents. First off, can you kind of talk about, obviously, to represent them, you're talking to these folks. What are some of the health, physical and mental symptoms you're still seeing? Not like we're talking over 2 years later. And it seems to me it's not just what do they say? It's always the cover up is worse than the crime. The crime, we know, I believe it is a crime, personally, what Norfolk Southern did. But it seems to me you have evidence here that these agencies were trying to basically conceal information, conceal that it was a lot worse than it was.
That's exactly what happened. The CDC came in and looked at sick people and said, you're not sick. And then they told the doctors not to help. Don't test. So I've talked to lots of clients and people affected who told me that they went to the doctor that night and the emergency rooms turned them away. Why? Because the CDC and the EPA told them to. And we actually have the letter from the CDC and the EPA that said, don't test these people. Don't testing is not advised. But there were, I always say in these situations, look for the helpers. And there were some helpers. And there were very good doctors from Penn Medicine, for example, University of Cincinnati, University of Kentucky, who wrote a contrary letter that said, no, please do test people and ask at a minimum for complete blood count, metabolic panel, liver function. So the good guys were saying, no, you can help these people. But the ones who were supposed to be advising and helping, the CDC and the EPA, were telling them not to help.
Right. And to be clear, part of specifically for vinyl chloride, which obviously was detonated, vinyl chloride linked to several different types of cancer and other health issues. But the CDC was claiming, well, we're instructing not to test for it because it metabolizes through your system so quickly that you won't find it after 24 hours. Well, that's assuming that it has dissipated and it's no longer in the environment with people being exposed to it consistently.
It's also not true, because people did get tested and did have positive results.
Right.
And they literally took the test off the market. Quest took the test off the market right after this happened. Why? Because they don't want to know. And we saw the same thing in Red Hill in Hawaii, by the way, the exact same thing. They tested for the wrong things. So these government agencies come in here, and I know you've reported on it in the past, but the CDC or the EPA grounded the plane that was going to test for the appropriate chemicals. And then they got in the air eventually, and they didn't test for the chemicals that were at issue. So we have these agencies coming in and saying either don't test or test for the wrong things, and allowing the bad guys like the railroad to do their own testing and then claim it's all within acceptable limits. And so here's how this plays out, Jordan, in every disaster, right? The bad guys come in, and I'm sorry, I'm saying that I know you're with me. CDC and the EPA in this case are the bad guys. They come in, and the railroad too. And they say, first of all, they don't test for the right things, but then the testing that comes out, they say it's all within acceptable limits. And there's not enough X, whatever X is, well, it's vinyl chloride, fuel, whatever. There's not enough X to make people sick. Therefore, anyone who is sick is psychosomatic or crazy, right? That's the natural conclusion. So instead of actually doing the appropriate testing, they'd rather call thousands of people just a little bit dramatic and loony.
And I want to show you, because I believe we actually broke some of this 2 years ago.
You did.
But
we've been talking about it.
2 years ago, we got audio from a resident who went to the local Mercy doctor. Mercy is a chain of medical providers in Ohio and elsewhere. And he was asking for a vinyl chloride test. And he was told in several different ways, we're being told not to provide that. There's 3 clips we have. If you don't take away from this that something is not right in Kansas here, something doesn't smell right here. Let's play the first clip. This is a resident who went to try and get testing for vinyl chloride.
There's nothing to test for. There's a certain time frame they're telling us it has to be done.
But even if I'm paying for it out of pocket, even though there's a certain time frame, why can't I still get the test just out of good?
You know what? I'm going to have you talk to one of the nurses.
Okay.
If it's a daily exposure, there's no time limit.
Because
you were just exposed.
Well, that's the problem I'm having here. We're being exposed daily, so they don't want to say they know that it's out of your urine.
They're saying it's a time frame from exposure. That's what it
So
is.
what if I pay for my own test and I don't care about the time?
So, Christina, that goes to what you were saying. You hear whoever that was, somebody at Mercy, saying, we're being told by CDC not to do it because there's a time frame that you would catch the vinyl chloride. Say what you want about RFK. I'm not making this about RFK. A lot of people think he's cockamamie, as do I. And some of the stuff they're doing now is cockamamie. But that's not even true, what she was telling them, because people months later were getting tested and getting positive hits for elevated vinyl chloride.
Well, and what's the harm in testing, Jordan? What's the harm in testing? Just give the person a test. Your patient is coming to you and asking, please give me a test. Why is it that in these situations we look at them and say no? If you go to your doctor and you say, can you please test me for cholesterol? They're going to give you the test. Of course they are. Why not? So why are you refusing to test people in the immediate aftermath of a toxic event if it's not just that you don't want to know the results?